Lona need blepharoplasty because Lona's eyes is puffy due to excess fat and she also have excess skin.
Joining this live stream with me today is none other than the director of Viet Plastic Surgery Hospital, Dr. Chiem Quoc Thai. I want to give every viewer a sincere greeting. Let me start the program by sharing with every viewers currently watching this live streams and Dr. Chiem Quoc Thai about my beauty enhancement journey with Viet Plastic Surgery Hospital. In the previous episode of this series about insight on beauty enhancement, I shared about rhinoplasty, which is the procedures I had to improve my nose's aesthetic, which are minor surgeries, right, doctor? The result is brightening my face and it certainly boosts my confidence a lot. So let's move to topics about eye aesthetic enhancing today. So perhaps first, can Dr. Thai share with everyone what was the problem with my eye aesthetic and which cosmetic procedures did you perform to improve it?
Today, I will share my knowledge about cosmetic surgery methods. So any remaining concerns or question among the viewers can be resolved. Asterisk. Last time we discussed rhinoplasty methods using rib cartilage, which was the procedure performed to improve Lona's nose. So the topic of today is how to achieve beautiful eyes through cosmetic treatment. We can all agree that the eyes are the window of the soul. In Lona's case, she used to have beautiful eyes, but lacked the feeling of brightening due to excess fat causing its puffiness, and also the excess skin. Generally speaking, for eyelid procedures, we have two main methods: non-incisional blepharoplasty and incisional blepharoplasty. The criteria for choosing depends on your specific condition. If you have excess skin and excess eye fat, you need incisional blepharoplasty. But for those who don't have excess skin or excess fat and have only a single eyelid, then we perform non-incisional blepharoplasty. Asterisk, because Lona had excess fat plus excess skin. We chose incisional over non-incisional for her case to address both issues.
So non-incisional blepharoplasty is less invasive?
Correct, but it's only suitable for candidates having mono eyelids without excess skin. In the other cases then, we have to perform incisional blepharoplasty to remove those excess skins.
From my own knowledge, fat will always accumulate within the body. So in cases when the eye fat accumulates again and causes puffiness, can we address those issues with revision procedures such as another incisional blepharoplasty to remove the excess fat again?
Let me show you the details of each option. For non-incisional blepharoplasty, the results will not be sustained because after the procedure, the skin continues to age and sag, causing drooping eyelids. We also didn't address the fat accumulation, so the fat will become more prominent and make the eyes puffy, eventually causing loss of the crease. That's why people say non-incisional blepharoplasty isn't permanent. When the skin sags down, the crease disappears. So patients who initially had non-incisional procedures typically need incisional blepharoplasty later on. However, once you've had incisional blepharoplasty with fat removal, that's it. Eye fat doesn't regenerate, so the results are much more long-lasting than the other cases.
Oh, so after we remove the eye fat, it does not regenerate. So the fat can cause the crease to droop only when patients choose to undergo non-incisional blepharoplasty.
Exactly. That's why we need incisional blepharoplasty to remove the excess skin and address the crease. Asterisk now, regarding fat regeneration after incisional blepharoplasty, eye fat is different from belly fat. Once we remove eye fat, it's gone permanently and doesn't accumulate again. The only exception is if you gain excessive weight, like dozens of kilograms, then eye fat might return, but the rate is low. We also need to be careful not to remove too much fat, or you'll get hollowing. We only remove just the right amount so it looks natural. Asterisk, in Lona cases, maybe in 10 or 20 years, then we will see the eyelid skin begin to sag and need a revision. Surgery to remove the excess skin, no need to modify the double eyelids.
When we remove excess skin in those cases, do we have to cut along the eyebrow area? Can you give the exact answer?
It depends on where the skin is sagging. If it's at the outer or inner corner, if the icer, the tail of the eyes, then we have to perform a brow lift. But if they're sagging across the entire eyelid area, then we need a revision procedure. We only remove the excess skin this time.
People often share this common thought. Since we will have one procedure only and the fat keeps accumulating, let's just remove a lot of fat at once. But from my experience, there are many cases where this thought causes some issues such as inability to have full eye closure. What are the exact reasons here, doctor?
The inability to close eyes completely is due to the surgeon removing too much skin. This is called 𝐃𝐢𝐫𝐿𝐻, causing you to sleep with your eyes open. Furthermore, if the surgeon removes too much fat, then the eyes become sunken or hollow. That is when the eyes lose their natural appearance and become sunken inward. It's called having hollow eye sockets. That's right. At that point, we have to take fat from your own body to inject back into those hollow eye sockets.
So at that point, we have to inject autologous fat into these eye sockets to reverse the effect. It's true that what impresses me most about a person's appearance is their eyes, because it's where we communicate without words first. Just by looking at each other, if we happen to catch each other's gaze, you know that saying about catching someone's gaze. It leaves a very strong impression. Looking back at my photos from when I was just crowned first runner-up of Miss World Vietnam 2019 and when I competed in Miss Grand International, even though I had non-incisional blepharoplasty done, our makeup artist had a technique where they would create the crease, but it was very difficult because there were multiple layers. I had 2-3 eyelid folds, so it was very challenging. And when I looked natural without makeup, it would make my face appear very dull. So when I decided to have an incisional blepharoplasty procedure, the final result is a brighter face and I feel more confident.
I made your eyes bigger and longer and open your inner eye corners because you have epicantthal folds covering the inner corner, which made it appear smaller.
I had both incisional blepharoplasty and inner eye corner opening. Someone is commenting that there is no way my eyes will not become big and beautiful after those procedures. Someone is asking, if they have excess fat and skin and want blepharoplasty like my combo, what would be the cost, doctor?
It depends. If it's just incisional blepharoplasty alone, it's 12 million VND, and if we have to perform an inner eye corner opening, that's an additional 10 million VND. Inner eyes opening method made the eyes appear longer and cost 10 million Vietnam dong, and incisional and non-incisional blepharoplasty cost 12 and 10 million respectively.
So the price list will be non-incisional and incisional blepharoplasty cost 10 million and 12 million respectively, and inner eye corner opening is an additional 10 million. You can combine multiple methods together like me. Having both incisional blepharoplasty and inner eye corner opening cost would be 22 million. A viewer is asking, how long is the recovery process?
For incisional blepharoplasty, for the first 7 days, just avoid heavy work and wear glasses before going out. Avoid sun exposure for the first 3 months. Remember to apply sunscreen, otherwise you'll get scarring or darkening. Normally, just wearing glasses when going out is fine. Within 7 days, the sutures will be removed and it will look good.
Do we need to avoid certain activities in this recovery period, such as phone surfing?
No need, just avoid heavy work so it doesn't swell.
So we only need to rest and avoid heavy activities for the first 7 days. And after suture removal, we can resume normal activities. But generally speaking, the more carefully we take care of it, the better the results. So to summarize our eye procedure pricing, inner eye corner opening is 10 million, incisional blepharoplasty is 12 million, and non-incisional blepharoplasty is only 10 million. How long does the eye procedure take? I'm not sure if this viewer is asking about the surgery duration or the healing time.
The procedures last only for half an hour. For recovery process, give it 7 days and it will look good.
During that half hour, from my experiences, the surgeon only used local anesthesia. The patient lies on the operation table with their eyes closed, listening to music and relaxing. The procedure is then completed before they wake up. Actually, they can go home immediately, but if they're really worried or encounter some complications, you can stay so the doctor can monitor you more closely for accuracy.
With local anesthesia, you can go home right away. We just apply light bandaging, then you wear glasses and go home.
I'm very impressed with Lona's eyes. Can I get blepharoplasty procedures like yours to have big, long, and beautiful eyes like yours?
We can do inner eye corner opening or outer eye corner opening combined with incisional blepharoplasty.
So that means that every pair of eyes will have a combinations of suitable methods that we can use to achieve eyes like Lona's. So everyone should come to Viet Me Plastic Surgery Hospital so that Dr. Thai can assess your specific situation. A viewer named 𝐃𝐢𝐫𝐿 is asking, if I want to undergo blepharoplasty procedure like this, what do I need to prepare, Dr. Thai?
For blepharoplasty, what you need to prepare is if you need to rest for the first 1 to 2 days to avoid heavy work. If your job involves a lot of interaction with people, then just 2 days off is enough. After that, you can wear glasses when going out, you can go to school, or do whatever you need. You just need to prepare to stay home for 1 to 2 days post-procedures. No need for pre-procedures preparation.
But everyone shouldn't worry because when we say no preparation needed, we mean no preparation regarding recovery planning. However, before performing any surgery at Viet Me Plastic Surgery Hospital, there's always a health screening process. So all health issues or conditions will be detected by the doctors, and they'll assess the situation to see if you're suitable for cosmetic surgery. Once that's done, we can rest assured that everything is ready. You just need to prepare mentally. To be really comfortable going into the surgery, then enjoy your new beauty. A viewer is asking, I already have blepharoplasty, but my eyelids are uneven. Can I have a correction procedures?
For revision surgery, I need to examine your situation in person. There are cases where it can't be corrected because previous surgery has removed too much skin. So there is no skin left to perform the revision surgery.
Doctor, let me ask. If too much fat was removed, we can inject our own body fat back in. But if there's insufficient skin, can we fix that? How do we compensate the lost skin for that case?
There is no solution. The patient just have to accept it.
So that means in those cases where too much skin was removed, then it cannot be fixed. To answer the previous question, the best action to take here is to come to Viet Me Plastic Surgery Hospital so Dr. 𝐃𝐤𝐿 examine your eyelids condition and determine the correct solution. Hello, doctor. My eyes have creases but a lot of fat. What should I do to make them bigger and more defined?
As I mentioned, you need incisional blepharoplasty with fat removal.
And I think we can always perform an inner or outer eye corner opening in the same procedure to make the eyes longer. Listen, everyone, please act quickly. Please follow all the information about beauty services at Viet Me Plastic Surgery Hospital. Maybe until now, everyone only thought Dr. Thai was famous for breast procedures, but now all other services available at Viet Me Plastic Surgery Hospital, for example, thread lifts or other non-invasive beauty treatments, or 𝐕𝐢𝐿𝐼 liposuction are having 20% discount program, and that program won't last forever. The most common question is if we come to the hospital for in-person consultation, can we meet Dr. Thai?
If you schedule an appointment in advance, I will consult with all of you. If you've already made an appointment, I will definitely arrange time to consult with you. Don't worry.
There's one more thing. Even though Lona is a celebrity case personally handled by the doctor, the process is still the same. Lona schedules an appointment for consultation. Before meeting Dr. Thai, Lona meets with the consultation staff first. They will ask about what procedures I'm interested in or body features I wanted to enhance, then provide pricing and give preliminary consultation. After that, once I've decided on the service that best fit my desires, the consultant staff takes me to meet with the consulting doctors, and I meets Dr. Chiem Quoc Thai. Whenever I visit the hospital for skin treatments or other procedures, I also meet Dr. Thai for consultation. So basically, the consulting doctor is almost always Dr. Chiem Quoc Thai. So everyone shouldn't worry about this topic. And especially when you schedule a consultation appointment in advance, your beauty treatment journey will proceed faster and you'll 100% get to meet Dr. Thai.
In my plastic surgery hospital, we have multiple departments, the plastic surgery department and the dermatology department. If you're doing skin treatments, we have dermatologists who specialize in that to consult with you and clearly explain what treatments are like. For surgical procedures, when you come here, our consultation staff will help you with preliminary information about what procedures you need. They'll prepare 3D imaging for you beforehand, so that when you meet with me, I'll use that 3D imaging for consultation, making it easy for you to see what you'll look like after surgery. We'll then finalize what services you need, so don't worry. Anymore, come and work directly with the hospital and you'll receive all these services.
There will be many upcoming live streams in the futures that also bring comprehensive information, expert insights, and knowledge about all other cosmetic services like what we have today for everyone. And in case you still have other questions that cannot be addressed during this live streams due to time restriction, you can prepare, writing them down and save those questions for the next live streams that and Dr. Chiem Quoc Thai will bring to everyone. For now, thank you for watching, have a good days, and I hope to see you again in the next episodes. Viet Me Plastic Surgery Hospital, turning dream into reality.